reports. Have here Neil Harrington and Gene Baldwin from Public Health to address Anderson Lake and potentially to also talk a little bit about swine, a little more background on swine flu. Neil?
I was actually going to hand it over to Jean since she's more in the news today than I am. If that's all right, Jean, or do you want me to go first?
No, it's fine.
Okay.
She looks like she's ready.
Sort of. I actually, so many of you have seen the newspapers, you know. We don't, oftentimes public health doesn't make the front page of the New York Times. But influenza A or swine flu cases are appearing in Mexico, Spain, British Columbia, and several US states. It's an outbreak because it is spreading person to person. And there are no Washington cases at this point. It's very much a catch-up game at this point because there are many unknown questions. Why did the people in Mexico get so sick so fast? Why are there deaths in Mexico and it's treatable here? It is still a treatable illness. It does respond to antivirals. People are working very, very quickly at a national level, coordinating the Center for Disease Control, the National Health Institute, to look for vaccines in the long run and to also look for, to make sure that we're monitoring in the antiviral treatments. So Jefferson County Public Health's role is in coordination with national and state public health officials. We're increasing the local monitoring and tracking, which is surveillance of the disease locally. And since we are still in flu season, we still have that same infrastructure going. We have had a very mild flu season, so there shouldn't be red herrings among the flu, so we should be able to watch this pretty well. We're also planning and coordinating with healthcare, government, private sector, community-based partners, and getting a number of messages out for the public to protect themselves. We've been in touch with local labs, doctors, and the EOC since Friday, and have had 2 all-state phone calls over the weekend dealing with transportation of cultures to the state lab, how the state lab will handle it, all those, the infrastructure stuff. Public announcements will change daily, so we will be posting things on our webpage. And because this is going so quickly, many, many things about the specifics about the flu, who's at highest risk. It appears to be N1 flu viruses attack younger, healthier people because they have a stronger immune system. So that whole illness cycle is under scrutiny right now, so there'll be more out there. It's not like normal flus where it attacks elderly. There also will be a regional plan that is specific to citizens of Olympic Peninsula, and this is the regional plan for the Olympic Peninsula, but the specifics on screening, surveillance, treatment will be available. Right now, screening is being completed by private physicians locally. They all have their equipment, they're all up to speed, they all know where they're sending it, and we're working with the transport issues around the bridge, which is not my idea of a good time. It's kind of like, oh. The bridge being down will mean that we will probably have our own local stockpile here rather than having it regionally for treatment. Ordinarily, we would have the treatment supplies stored in Kitsap, but with the bridge, we'll store them here. The most important message is to prevent the spread of respiratory illness by covering a cough, wearing a mask if in public, the big one, washing hands. Don't leave home if you're ill or have a fever, especially if you have a fever. Contact providers if you are ill or have recently traveled or been in contact with someone who has traveled at this point to the outbreak site, which is mostly Mexico. We do have a number of citizens who have traveled and who are traveling or who go back and forth. We have an outreach going to both our Hispanic populations who go back and forth and to, we have a number of folks who live, have houses in Mexico and go back and forth. So we will be getting those messages out. The role of county government, we did open up our branch of emergency management this morning. Now, we are not the EOC, we are an ECC, we are a branch under Bob. So we are using the emergency management system for communication. And so, like, if we have a blast fax, which we sent out to all the physicians, I send it to Bob and he sends it to the emergency management people and to the fire departments. But our role of county government, according to our plan, is developing a staffing plan to address surge capacity and making sure we have enough local resources and all those things. At this point, it is not an emergency at all, so the declaration of emergency is not involved from your end. It's purely a public health emergency. So I have two handouts here. These both look really simple, but they're very, very good because this one, please feel free to post around the courthouse or in your building out and, you know, down at the Leader and the Peninsula Daily. And so that one is a fact sheet about the swine flu and the other is about cover your cough.
Yeah, Gene, just quickly, I know that that I believe Port Townsend is a sister city with another city in Mexico. And I'm not sure if anybody's, I just remember this from high school because we were involved in that. But if that's a fact and is still ongoing, maybe it would be a good opportunity to check with those personnel and find out what their movements are. And
Then there's a group of kids. See, we do travelers clinic, so we know sort of international travel, where people go and where they are. Mexico is not required for any immunizations or anything, so we don't know that one. But we do know there's a school group from Quilcene that's currently in Mexico, and there's another whole group. There are two groups that we know of informally. Yeah, that's a good idea. I don't know about that piece yet. And hopefully by putting a lot of information on the webpage, we can get lots and lots of information to people so they, that the folks that call in are those that were actually exposed or that have an exposure.